The Minnesota State Retiree Council believes strongly that all people should have access to affordable and accessible quality housing and health care. And we're looking at health care today with Senator Matt Klein from West St. Paul, South St. Paul, Amber Grove Heights, Mendota Heights, Sunfish Lick, Senate District 52. And Senator Klein also is an MD in internal medicine, practicing at Hennepin Health in Minneapolis. Senator Klein, what problems are there in a urban area as far as being able to get quality health care?
Well, thank you, Dan, for the question, and thank you so much for giving me the opportunity to speak with your members. There are significant barriers to continued health care and good quality health care in our urban areas, and the biggest one is the problem that is faced nationwide by Americans, which is that the cost of health insurance, the cost of health care is just too high. People have extremely high copays and extremely high deductibles. Often a person will be paying a significant copay on their insurance, tens of thousands of dollars, and then they'll have a deductible that is so high that they can't go get sort of basic maintenance health care like a physical or a vaccine and so forth. So we end up discouraging people from getting preventive and quality early health care, and they come in later when they're more ill and have higher costs and so forth. So that remains the biggest problem, and I continue to work aggressively at the legislature on bringing down the cost of health care across the board. And hand in hand with that is the cost of drugs. So let's say I see a patient in my clinic and they have a medical problem, seizures or diabetes. I give them a prescription and send them out the door. Very often they'll show up at the pharmacy and they just can't pay the bill. And there's situations where I've looked patients in the eye and I've seen them pause and maybe look concerned or ashamed, and I know that they're not going to be able to fill the prescription that I gave them. And I've maintained, and I will continue to maintain, that we are a good enough and a strong enough society to stop that from happening, to make sure that our citizens have access to the medications they need for the health care they need. And Dan, the last thing is transportation. People in urban areas, particularly the people who most need health care, disabled people and the elderly, retirees, sometimes can't get downtown to a clinic in their automobile. We don't have we have the starts of sort of an alternative transportation system to get people to where they need to go, but it could be much more robust, and we continue to work on that here at the legislature.
And it seems incredible that living in a major metropolitan area that people would not have access to health care for those reasons that you mentioned, and insurance and prescription costs of prescription drugs and transportation are just so very, 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 very vital for all. So
it's so true, and I continue to see patients who, by all rights, they live here in the heart of Minnesota, in the heart of the metro area. They should have access to the top health care, but for the reasons I've described, they are suffering or they're coming in late for conditions where I wish I had seen them earlier, and I think we can do better.
Thank you, Senator Matt Klein.